Good afternoon. I have been requested to mention temporomandibular joint problems. And again, it's a compound problem. Lots of things enter into it. And again, people think they have a sinus infection because the whole side of their head hurts. Their face hurts here, their face hurts here, on the hip here. And what we have to remember is that the chewing muscles, the temporal muscle attaches right here, and the masseter muscle attaches right here, the chewing muscle here. Most of the pain that we feel around muscles and bones and things is where the ligaments and tendons are attaching to the bone. And this is where a lot of the problem starts. When we have that, it has to do with the fact that temporomandibular joint problem, if I can say it correctly, is related to clenching the teeth. Okay, what causes clenching of the teeth? Again, stress. Of course, none of us have that anymore. Poor sleep, poor rest, anxieties, family problems. All of these things primarily are problems that we are having to deal with that cause the added stress. Clenching of the teeth is kind of an unconscious or unrecognized thing, because most of the tooth clenching happens at night while we're sleeping. Another thing that's bothering us, which is making our sleep inefficient, and I may have mentioned this before in a recent discussion, has to do with acid reflux. If the acid is coming up into your esophagus at night, the esophagus sends a message to the brain, there's something foul coming up, so you are aroused, not wakened, aroused out of the restorative level of sleep. So you're aroused, so the swallow mechanism goes back down into your esophagus, in your stomach. When this happens, this interferes with our restorative level of sleep, which increases the stress even more. And the only way we can get rid of stress primarily is exercise. And the only exercise you're going to get when you're sleeping is clenching your teeth. So we can greatly decrease the problem with the pain in and around the head. People think they have sinus infections when what they really have is TMJ problems. This is from clenching the teeth. As I said, the face hurts because the chewing muscles are attached to portions of the face. The only real way to help protect from that is with a tooth guard. Now, a lot of people will get a dental tooth guard. It's a hard acrylic, costs a lot of money, and I don't think it works as well as a $7 one from Target or Walmart or whatever, the same as the little football player tooth guard. It is a soft rubberized compound, and you put it in hot water and you mold it to your teeth, and then you wear it at night, because every time you clench your teeth together, it reminds you to push it back, and it reminds these muscles to stop clenching. I use the example, I can take a rubber ball and I can lock it in my hand like this for a long time. I can take the same rubber ball and squeeze it a bunch of times like this, and then my muscles on my arm begin to get tired, and I can't do that anymore. So when you use the tooth guard, it's telling these muscles here and up here to stop clenching. Now, the tooth guard we're talking about is one of the simple football tooth guards, whatever. Usually they're white or some kind of fancy color, depending on what color you want, but they cost only about $7 or $8 at a Walmart or a Target, whereas the manufactured tooth guards of hard acrylic or whatever can cost several $100s, and I haven't found that they work as well. I have people come with TMJ problems, and they have a tooth guard, one of those hard acrylic tooth guards, and they're not getting the relief that they think they ought to have. And we say, okay, we can try this. It only costs you $7. So they try the tooth guard, and they find out that it gives them more relief than the other very hard acrylic thing, which they could bite against just as hard as they can their own teeth. I'm interested in the tooth guards, the rubberized silicone tooth guards. Usually they're white, that the little kids use, because those are the ones that prevent the tooth from clenching a long time, because they do push back and remind those muscles to stop doing that. So using a tooth guard for TMJ problems to help protect from that while we're getting rid of the aggravation that's causing the stress and the gluten in the first place. When we're managing that with our diet and improving our sleep and all these other things work together. And again, the primary cause of disturbed sleep is gluten. I don't care what the gastroenterologists say, it's gluten. So I hope you find this to be helpful, and I appreciate your time. Thank you.